a wife and a mother of 4. All my children are older, otherwise I don't think I would have made it through this program. I'd like to acknowledge that I'm a visitor here on the traditional territory of the Wasanich and Lekwungen peoples of the Coast Salish Nation. My daughter would be very proud that I could pronounce that. I'd like to thank my supervisor, Leona Starr, and her supervisor, Dr. Kathy Canoe, at the First Nations Health and Social Secretariat of Manitoba, also known as FNISM, or the Aboriginal name Nananda Wigamig. I'd also like to thank Wendy McNabb at the Partners for Engagement and Knowledge Exchange, or PEAKS, for supporting this cultural safety in dentistry webinar. I'd like to thank Betty and Nigel for putting up with me in this practicum. I'm very forgetful. I'd also like to thank my readers, Dr. Nigel Livingston and Dr. Charlotte Lopi. And lastly, I'd like to thank the School of Public Health and Social Policy, especially Dr. Trevor Hancock and Dr. Charlotte Lopi for helping me in my future endeavors after this program. I'd also like to thank my family. My husband's actually here. This is the very first presentation he has been allowed to sit in all the years we've been together. I think I have a little bit of practice, so he's allowed to sit in here. So my project actually is putting together a webinar, so thank you, Aidan, for going through the whole process and what a webinar is. I don't have to go through that now. My project was actually putting together a webinar for PEAKS, which is in the oral health pillar of this CIHR funded project, which is part of FNISM. It's actually very complicated. One of my one of my goals in my practicum was to learn the different areas of this organization in Manitoba. So before I started my webinar, I had to answer a couple questions. And these are the questions I kind of went through to determine if it was needed. You know, what was the Dental Society doing to participate in reconciliation? And have we looked at how we're delivering dentistry to Indigenous patients? For me, from 2005, I practiced in First Nations communities in Manitoba. Having that experience, work in clinics that are actually funded and run and guided by the federal government gave me a little bit of a unique insight, and it is very different than what you would see on the streets here in Victoria or in Winnipeg, where I am. With that being said, they do have some similarities that we'll discover later on. So what I did in order to find out what is out there, I scanned the literature. I didn't find anything that was available for the Dental Society, not only in Manitoba, but when I looked closely across Canada. I contacted the Canadian Dental Association. According to their response, they weren't aware of any education that was being provided to the Dental Society. They recommended to contact the associations, and 7 of the 13 dental associations responded. Again, they were not aware of any. However, 2 contacts indicated that there was an Indigenous cultural safety training available but not required. 5 of the 10 dental schools responded. Again, there wasn't really anything available at all. They did mention that 2 dental schools offered rotations that included visits to Indigenous communities where it was required in their teachings. We came across this slide yesterday, one of the lectures yesterday. One of the things when I started off in dentistry, I went out there and I wanted to make a big difference. So I started in, and the work for me was actually very overwhelming. I was able to work really hard. I worked over my lunch hours, I worked overtime, and I was able to keep up with the need in the community. But one of the things that I was missing out that I planned when I went in there was making the future difference. So about my halfway point in my career, I stopped because I just felt like I wasn't making a difference. I had children coming in still, you know, that needed to go off for surgeries. So I stopped and I thought, you know, well, how do I make a difference? At this time, even coming through dental school, one of the things that I was taught going through dental school was to treat everybody equally. and learning from this program, that was actually a form of racism. It's cultural blindness. So me coming in as a First Nations dentist, I was actually doing harm in approaching it that way. So when we're delivering dentistry that way, in an equality, basically what we do is default on providing care to a default standard, which is that for the dominant society. It creates a power imbalance, which is we probably all learned with cultural safety. And of course, we fail to meet the needs of Indigenous Canadians. Indigenous health inequity is not an Indigenous problem, but the outcome of Canadian society attitudes and behavior toward Indigenous Canadians. And that was part of my project. I wanted to implement not only cultural safety, but I also wanted to encourage reconciliation as well. Did you know each of the 7 flames in the circle of the Truth and Reconciliation Commission of Canada's logo represents one of the 7 sacred teachings: truth, humility, honesty, wisdom, respect, courage, and love. And I don't think I have enough time to play the video. One of the things that I do recommend is watching Justice Murray Sinclair on the TRC website. It's actually a very important message that he delivers, and it's something that I've tried. I can't deliver it as effectively as him. So if you could just watch that, that would be amazing. Central to these are the 2 quotes actually that I found important for reconciliation and cultural safety in dentistry. Central to the challenges facing Aboriginal peoples in Canada today is the way in which they are viewed and understood or misunderstood by parts of society. Again, Justice Murray Sinclair says this very well. In my research, the Canadian Dental Association recognizes the need for targeted oral health programs for Indigenous peoples, where cultural sensitivity understanding is essential in developing initiatives to improving oral health. The knowledge is there, and in one of the sayings of the elders that sticks with me is if we can talk the talk, we can recognize that is an issue, and colonialism impacts Indigenous health, but now we have to walk the walk and we actually have to do something about it. My webinar has kind of evolved into its own little beast, so it's not just a webinar anymore. My webinar I present in September through St. Elizabeth Healthcare, supported by PEAK, which is also a part of FNISM. Again, Aidan went through all this, so I don't think I need to do that. Basically, for PEAK, what we do is we bridge the gap for knowledge translation. So basically the knowledge is there, and then we create action. When I get back to Winnipeg, one of the, I said it evolved into its own little beast. One of the things that I'm doing as well is I'm actually providing a continuing education lecture and got permission to use the webinar as the base for this lecture. Step forward in this one is that the Manitoba Dental Association is actually accepting this lecture as to provide credits. So I think by providing these credits, we actually get a better attendance. So more people are listening. Now, Nigel asked me to throw in a picture of teeth. And so I came to this one and I threw it in there. I thought everybody was just gonna look at it. But it's strange. This is one of the things that we see in the clinic, and this is one of the things that made me, why I'm here today, actually. We have the child come into the clinic, and the response for this would be to refer the child off for surgery. That's our current thought in dentistry. What I want to get, where I wanted to make the change is having dentists look at this and look from a public health perspective, looking at the past, the present, and the future. This child, we send this child off to have surgery. We fix the problem, but then we send this child back into the community where the dental disease occurred in the first place. So we're not really fixing the problem. That's what I want to do. And here it is, basically participation and reconciliation and teaching cultural safety in dentistry to dentists. So how does this contribute to public health? In many ways. So my goal of this webinar and my future endeavors is to teach the dental society to not only be better dental care providers to Indigenous patients, but to be better people in Canadian society. And then I just wanted to end. Boozhoo, Wibishki Matadam Ojichida Kwe. Hello, my name is White Horse Warrior Woman. From my spirit name comes a responsibility to protect those that need protecting, and that what brings me here today.
Thank you, Sheri, for some really pioneering work. That was excellent. And I should say, when I recommended that you include an image, I thought it would be a nice set of teeth. But it did. I'm not going to say work up the audience because they're wide awake and I'm sure they're very engrossed in your talk. So anyway, well done.
Thank you.
Very well done. I'm very moved and I appreciate the work. I just wanted to tell you that last year one of our BA students presented, and she is a dental hygienist with the Cowichan Nation, and for her practicum she did work with the elders around regular dental care, and I've learned so much from her and from you, and I thank you.
Thank you.
Yeah, thank you so much. What a great example of Be the Change. I was wondering if you could speak a little bit about how your practice will move forward, coming to that point where you couldn't practice the way you were anymore, and how you can work upstream within dentistry. I'm just curious about what that will look like.
Well, one of the things I acknowledged at the beginning of my lecture is the support that I received from Trevor and Charlotte. They provided me with references, and I was actually accepted into a residency program to specialize in pediatric dentistry. Moving forward and trying to go in the direction where I wanted to go, I think for me, it's children. Helping children is going to make a difference, and where I want to go is actually into policy making. Having experienced over a decade of the way dental care is delivered in First Nations communities, there's definitely deficiencies there that where I want to change.
At the end of this work, and I know it's sort of continuing, are you sort of more encouraged or are you somewhat discouraged in terms of how things are going in the future?
I think I'm more encouraged, but definitely much more motivated, especially having the knowledge that I learned through this program.
Excellent. Well, again, thank you very much for an excellent presentation.